webinar. Welcome again, everyone, to today's Singapore Cancer Society Gastric Cancer Webinar 2020. Even during this pandemic, Singapore Cancer Society is still doing what they have promised to the Singapore community, that they will look after everyone, create awareness for everyone. And as this ongoing effort to support the public to gain awareness on the gastric cancer. So this webinar was jointly organized by Singapore Cancer Society, supported by the National University Cancer Institute of Singapore, National University Hospital, Changi General Hospital, and Tan Tock Seng Hospital. Just some general information of gastric cancer is that the gastric cancer, also known as stomach cancer, is currently the 7th and the 9th cancer killer among Singaporean men and women, respectively. As we have said in the mailer, that gastric cancer is potentially a landmine. And this landmine, we should not leave any stone unturned. And this morning, we have lined up a group of specialists who will share with you on what is gastric cancer, detecting it early, treatments, and how to make healthier food choices to prevent gastric cancer. As I mentioned earlier, we are encouraging you to participate. So at the Q&A, we encourage you to actually put in your questions as the webinar continues, and also on Singapore Cancer Society Facebook page live, the comment boxes, you can also put in your questions. We will pull in the questions together, and I actually have a screen in front of me. If you look at me, that I was looking back and forth because I have a few screens in front of me, and I'm trying to catch all the information that's coming through. So at the end of the two speakers, we will have a Q&A session. We can't hear you, but we can see your questions. So do send us your questions, and we will try to consolidate and ask the questions. And very commonly, there's some questions you would ask. We hope to see those questions too, because there is no silly questions, but every question is important. I hope the doctors are ready. We are about to begin today's webinar. Gastric cancer, what do you need to know? Gastric cancer, or stomach cancer as commonly known, is one of the most common cancer in Singapore. Early diagnosis is important. In this webinar, Professor Jimmy So will be highlighting the symptoms, diagnostic tests, and various treatment options of this condition. Professor So, you can share your slides now. And may I now presenting to all of you, Professor Jimmy So, Head and Senior Consultant, Division of Surgical Oncology from the National University Cancer Institute of Singapore. Over to you, Professor So. Good morning, Josan.
Thank you, Ivy, for the kind introductions. Good morning to all of you to joining us in this morning's at the Gastric Cancer Awareness Month 2020. First of all, I would like to thank the Singapore Cancer Society, the team led by Pamela Kaur, Sarah Chen, and her team actually come up with this big effort to organize this first virtual public forum. And this is your large scale webinar. Therefore, I hope that all of you to bear with us for some of the teething issues to organize to have this kind of a large scale webinars, because you will always have face-to-face public forum, but because of the pandemics, we have to hold it in the virtual space. Second, I want to thank our moderator today, is none other than Ms. Ivy Lim, which has been a volunteer for the Singapore Cancer Society for the last 12 years, as you heard. Singapore Cancer Society is an organization that really run by the public, and volunteers is very important to our society. Therefore, people like Ivy actually contribute her efforts. We really much appreciated to joining us in volunteer in the Singapore Cancer Society. Also want to thank our next speaker, which is Ms. Wong, which is our senior dietitian. We can talk about the diet, which is how to protect our stomach. So last but not least, of course, we want to thank all of you to come on this Saturday morning to join us in this public forum. We know that in this pandemics, this is a really trying time for many of us. But during these pandemics, cancers are still present in our society. And many of us, many of our people are still suffering from cancer or have a new cancer diagnosis. Therefore, we still remember have to protect ourselves to fight with cancer such as stomach cancer. So thank you for all of you to tuning in for this year's Gastric Cancer Awareness Month. So my task today, we talk about how do we diagnose and how do we treat a gastric or commonly called a stomach cancer. And I'm from NUH and I specialize in this disease. To just take you through that what is our digestive system. Stomach is not the only organ in our digestive system, but it plays a central role in our digestion. Therefore, as the screen you can see from here, that when our food first ingested, you first pass through our esophagus, then enter into our stomach. Then from the stomach, the food will go into a small intestine and the large intestine. And that part of the digestion is from our liver because they produce digestive enzymes such as a bile, and they will enter into the digestive system, the gastrointestinal tract, to help us to digest the food. Therefore, the food after digestion will go into our large intestines, and then they will finish the course of a digestion. So this is how our digestive systems look like. Therefore, cancer in the stomach is common. It can affect the different part of the stomach. Now, this is a diagram showing the stomach. When they have cancer, also can affect in the commonly located in our lower part of the stomach. But also, of course, the cancer can affect the various part of the stomach, even the upper part of the stomach near the esophagus. As mentioned by Ivy, gastric cancer is common in Singapore and also in Asia. This is the top 10 cancers in both in Singapore men and also in Singapore women. And what are the symptoms of a gastric cancer? The most common symptoms of gastric cancer is the discomfort or pain at the stomach, which is located in the upper abdomen. And we commonly call it gastric pain, or the medical term, we call it dyspepsia. When the tumor becomes more advanced stage, they may present with a black color stool, because when the tumor becomes advanced, they will causing bleeding, and the blood in the stomach will be digested and turn into black color, and that's why it will appear black in our stools. And the stomach tumor, if it's causing blockage, the patient will present with vomiting. Yeah. And of course, if it's the cancer become advanced, the patient will have lost both the appetite and also loss of the body weight. This is what we call dyspepsia or gastric pain. And this is the area of our stomach. This is the area of the abdomen above our belly buttons. And then the discomfort over this region, we call it gastric pain or dyspepsia. This is how we define medically what do you mean by gastric pain. There's many different causes of gastric pain or upper abdominal pains, and many of them are not cancer, such as a benign peptic ulcer, ulcer in the stomach, or gastroesophageal reflux, or we call acid reflux. Gallstone also can present with upper abdominal pains. And of course, if there's functional pain, the patient have actually just some indigestions in the abdomen, in the stomach. We also can present with upper abdominal pain, and we know it as a functional dyspepsia. Last but not least, the one which we are most fearful of for the cause of upper abdominal pain is gastric cancer or stomach cancer. The most important test to identify the correct cause of a gastric pain is by a gastroscopy. Now, this procedure is done under sedations. And then what we do is we will pass the telescope. It's a very thin, flexible, soft tube inserted through the mouth and examine the upper digestive system. The procedure usually is done under sedation. The patient are sleeping, are sedated, therefore they don't feel the discomfort. The procedure usually takes a few minutes. This is the flexible tube you use for endoscopy, for gastroscopy. And from that, you can actually make a diagnosis very clearly. For example, like patient with acid reflux, you can see the evidence of reflux at the esophagus. You can see if a patient have a benign ulcers, you can see an ulcer in the stomach. Of course, if you see if there's a cancer, you can also easily pick up by a gastroscopy. As mentioned, the procedure is done under outpatients, take about 10 minutes. The procedure is performed with sedation, therefore the patient won't feel the discomfort of any of this procedure, and the diagnosis is quick and accurate. Just to give you a very short video clip, what is a live endoscopy look like. Yeah, therefore you can see very clearly with the telescope, you can actually examine the entire upper digestive tract, started from the esophagus like now, and then when we enter from the esophagus, enter into the stomach, then you can see it very, very clearly. Therefore, you can assess different part of the stomach that we use to always have some pool of saliva. We can remove it so that we can have examined the surface of the stomach and the esophagus clearly. That during the procedures, the patient actually is very comfortable because they are under sedations. They don't feel any discomfort. The procedure, it takes about 5 to 10 minutes. And you detect any abnormality, then we can actually take some biopsy to confirm the cause of the problem. Early diagnosis are important. That's why we have this talk and also this Gastric Cancer Awareness Month together with Singapore Cancer Society. Because like many other cancers, and early detections actually save life, and then gastric cancer in early stages certainly is a curable disease. Therefore, many of them, we actually don't know what's the cause of the gastric pain. Therefore, our advice is to do an early diagnosis through an endoscopy. If the person have, unfortunately, was detected gastric cancer, then what the next step will do will perform a body CT scan, which is a computer tomogram scan, or CT scan. From that, actually, you can look at the entire abdomen and including the stomach. For example, in this case, you can see the picture of the stomach on the CT scan. And this is the upper part of the stomach, which is normal. But in this patient, you can see the lower part of the stomach, the gastric wall was thickened. And this is the same location as detected by the endoscopy with a tumor in the lower part of the stomach. And also in the CT scan, we can look at the other organs such as the liver and the lung to look for the cancer stage. So the role of CT scan have two. One is to assess the stage of the cancer, whether it's the stage 1 or stage 2 or 3 or 4. And also from that, we can actually determine the therapy of the cancer. Therefore, the first part of the talk, I think we want to emphasize that gastric pain is common, but can be caused by many conditions, such as benign ulcers, gallstones, and also cancer. And in Singapore, gastric cancer is one of the top 10 cancer. Therefore, we need to have this diagnosis in my mind. And early endoscopy is very useful to make a diagnosis of the cause of the gastric pain and to rule out gastric cancer. If we detect a gastric cancer, certainly is not the end of the road, because there's a variety of a treatment. Therefore, next we'll talk about how do we treat a gastric cancer. Gastric cancer, the main treatment is surgery, but now there's a variety of surgery, what we call a tailor-made surgery, to tailor according to the individual's cancer. Yeah, if the tumor is small, we can perform an endoscopic surgery through an endoscope. Or you can do a keyhole surgery, what we call a laparoscopic surgery, or you can perform the surgery through a standard surgery like this. Endoscopic surgery is suitable for early stage cancer. This is how we perform using the same endoscope we use inserted through the mouth. And using the endoscopic techniques, we remove the cancer from the lumen of the stomach. And of course, this procedure is very welcomed by the patients because there's no incision required. It's simple. And the most important that you can preserve the entire organ except the lining, which harbor the tumor. Therefore, the side effect and the risks are much lower compared to other treatment. But this surgery, this type of endoscopic treatment is only suitable for stage 1 cancer when the tumor is only on the lining of the stomach, on the superficial layer of the stomach, then it's suitable for this. When the tumor go into stage 2, then we will have to remove part of the stomach because in those stages, the tumor may spread to the lymph node around the organ. Therefore, endoscopy treatment is not the good treatment for those situations. But now there's many ways to do a surgery. And one of the popular way now is actually using a keyhole technique, or what we call a laparoscopic surgery. The laparoscopic gastric surgery is actually first performed by Dr. Goh in Singapore, one of my previous mentor in NUH, more than 30 years ago, close to 30 years ago. And by performing a keyhole surgery like this, just a few keyhole on the skin, certainly the patient after the surgery experience will be less pain and a faster recovery. This type of surgery is suitable when the tumor in the early stage, like stage 1 or stage 2 cancer. Over the years, laparoscopic surgery are getting more and more common. And then you can see from the trend, this is the old slide. We can show that even in a few years ago, now I think close to half of our patients, the cancer are removed through a keyhole surgery without an open incision. There's 2 types of gastric surgery are commonly performed for stomach cancer. One of them is partial gastrectomy, when part of the stomach is removed. And then after the cancer is removed, we join back the small intestine to the upper part of the stomach. But when the stomach, the tumor is very large, involving the whole stomach or in the upper part of the stomach, then we need to perform what we call a total gastrectomy. Then where the stomach is removed, then we join the small intestine directly to the gutlet, to the esophagus. The many people will ask, without the stomach, how do we live? Fortunately, our digestion is actually performed mainly by our small intestines. The role of digestion by stomach is only about 5% of the overall digestions. The main function of the stomach is a reservoir rather than the actual digestion itself. Therefore, even the stomach is removed, we still can have a relatively normal life. The many patients will be asking us, what's the life after stomach surgery? Then we always reassure the patients that actually the small intestine, which is the vital digestive organs, we can't live without small intestine, but we can live without our stomach because stomach is just a reservoir, it's not a digestive organ mainly. So the patient, after stomach surgery, they can still enjoy normal food, like rice and noodles. And what only thing you need to do is, especially in the first few months after the surgery, we advise the patient to take a small frequent meals because the reservoir is either smaller or removed. Therefore, the patient may feel full quite early after the procedure, what we call early satiety. So to supplement enough food, therefore we always advise the patients together with our dietitians, the patient to have small and frequent meals. And commonly, we also advise the patient to take some supplements like vitamins, just to have ensure a full nutrition for the patient. Therefore, through the years, actually, we have a lot of public campaign to advise the patients about treatment of stomach cancer so that they know that even after treatment, such as after a surgery to remove the stomach, the person still have a good life after enjoy a normal life in full, with fullness like this, after the surgery. And so patients without the stomach actually still can live a relatively a good fruitful life. Another form of treatment for gastric cancer is chemotherapy. They're usually either one chemotherapy drug or a combination of a few drugs are used, and usually are used for people who are a little bit more advanced stage, like stage 2 or 4 gastric cancer patients. And there's many forms of chemotherapy, and most recently, actually, many of the chemotherapy are using a tablet form, like a pill. Though this certainly are more convenient for many of our patients. Sometimes chemotherapy will combine with radiotherapy to give together. Though radiotherapy is also a form of treatment for cancer, what it does is using X-ray to kill the cancer cell. So the procedure is something like we take an X-ray, but apart from a few seconds, the X-ray procedure may take about 5 or 10 minutes and allow enough X-ray energy to kill the cancer cell and to treat the tumor. Throughout the last years or so, we have developed many new forms of treatment for gastric cancer, especially for patients with advanced gastric cancer. And here in NUH, and many research are ongoing to advance the life of a patient with this dreadful disease. One of the treatments we developed earlier is called intraperitoneal chemotherapy. So this is our side view of our abdomen, and peritoneal cavity is actually the cavity containing all our abdominal organs, including the stomach. And in advanced gastric cancer or in many digestive cancer, they like to spread to the lining of this peritoneal cavity. We call it peritoneal metastasis. And instead of give chemotherapy directly in the circulations, then by giving chemotherapy into the peritoneum, what we call intraperitoneal chemotherapy, allow us to directly attack the cancer cell with the stronger dose of chemotherapy without a systemic or without more side effect to the patient, because the chemotherapy mainly will stay within the abdominal cavity without absorbing into the circulation, which cause the side effects. Then what we do in the intraperitoneal chemotherapy is to put a chemotherapy catheter, and then we put a access port under the skin, so allow us to administer chemotherapy in the clinic. As mentioned, why we're using this intraperitoneal chemotherapy? The peritoneum is the most common site of spread from gastric cancer, and usually the patient, once have the spread in the peritoneum, the chance is very poor. Therefore, we know that intraperitoneal chemotherapy may be more effective than the usual standard chemotherapy we give. We have started this procedure in 2015. This is one of the media release. We mentioned that these treatments have when we started this chemotherapy for our gastric cancer patients. And throughout the years, many of our patients have received this treatment. These are people with advanced cancer. And we hope that by doing this, the patient will have better results from our treatment. Another treatment which is more recently developed in the last 2 years is called PIPAC, which is Pressurized Intraperitoneal Aerosol Chemotherapy, or in short, PIPAC. And what it does, as mentioned, that most of the gastric cancer are within the abdominal cavity. Or instead of giving the chemotherapy, the usual liquid or solution form, why don't we change it into the aerosol form or gas form? because our abdominal cavity is a closed space, and gas is it can distribute to the more evenly within the abdominal cavity. And when we apply the pipette treatment, this chemotherapy gas will inject into the peritoneal cavity with pressure as well. By using gas with pressure, the chemotherapy agent can distribute more evenly within the space and also penetrate deeper into the cancer tissue, and that it can be more effective for cancer treatment. Just to show you one of the concept of this new treatment called pipette therapy. This is a cartoon, show the procedure. This is the nebulizer we use for this chemotherapy therapy. The chemotherapy you're doing in the operating room setting. The patient is under general anesthesia. The procedure is performed through a laparoscope. Therefore, it's a keyhole technique. We'll put a camera inside the abdominal cavity. And we're using two keyholes, as you see here. One hole is for the nebulizer, and this nebulizer will connect it into a high pressure injector. And this nebulizer will insert it through one of our small wound in the at our belly buttons. And then the next hole is putting the camera for us to observe the procedure live. Therefore, this is the video show the applying the intra-abdominal aerosol. This is a chemotherapy aerosol. And because it's aerosol, then this chemotherapy agent can distribute throughout the abdominal cavity where the disease and the cancers are. And they are applied with pressure. So this chemotherapy will go deeper into the chemotherapy, into the tumor tissue to kill the cancer cell. There's many advantages of these new techniques which we are developing. First of all, this procedure is what we call a minimal invasive. It's a keyhole techniques. Usually can perform with day surgery. We are make use of the physical property of a gas, which is allow the drugs, the chemotherapy drug, to distribute more evenly within the abdominal cavity. Secondly, we apply the chemotherapy with pressure. Therefore, the chemotherapy can enter deeper into the tumor and make it more effective to kill the cancer cell. And last but not least, the procedure actually performed with a laparoscope with a camera system, so that we can actually see whether your tumor is responding to the tumor under our eyes. We introduced this procedure at the end of 2016 when we performed the first pipette procedure in Asia in our hospital. And finally, this is the overview treatment for gastric cancer currently. You can see that gastric cancer we divided into stage 1 to stage 4, where stage 1 is the early stage and stage 4 are the advanced stage. When the stage 1 is early stage, we can allow a less invasive treatment, such as an endoscopic treatment or laparoscopic surgery. When stage 2, then usually they will require some form of surgery, either a keyhole surgery or open surgery. And when it becomes more and advanced, then we need to use a combination of treatment, including surgery, chemotherapy, and radiotherapy to treat the cancer to make it more effective. And even for advanced stage of a gastric cancer, there's many new forms of treatment, combining various types of treatments from surgery to chemotherapy and new agents such as pipette. Nowadays, treatments of a cancer usually through a multidisciplinary team. This is our NUH upper esophageal gastric cancer team, which is our team comprised of surgeons, medical and oncologists and radiation oncologists, physicians, pathologists, and radiologists, and to plan the treatment for our patient with stomach or esophageal cancer. And through the years, we have developed many new treatments that in our center hope to extend life for our patients, even they are advanced stage. To conclude, ladies and gentlemen, symptoms of a gastric cancer are easy to miss because they are quite non-specific. If in doubt, endoscopy is the best choice to detect gastric cancer. There's many treatments available nowadays to treat this disease. As like many cancers, if we can detect the cancer early, gastric cancer can be cured. With this, thank you so much for your attention, and all of you, please stay healthy, and we welcome any questions and comments. You can either email me or using this forum. Thank you so much for your attention.
Thank you, Professor Su. So I've known Professor Su for 12 years. He hasn't changed a bit since day one. He looks exactly the same when I met him in 2008. We are what we eat. So our diet and all our eating habits would create a different type of health for us. So the next up we have on healthy eating for your stomach. Poor dietary choices and lifestyle factors could increase the risk of gastric or stomach cancer. Next up at this webinar, we have Ms. Wong Wei Yi, and she will be explaining the benefits of certain foods and nutrients that may be protective against gastric cancer. Ms. Wong, are you ready?
Yeah.
And presenting to you, ladies and gentlemen, across the Zoom screen, we have Ms. Wong Wei Yi, our senior dietitian from the National University of Hospital. Ms. Wong, over to you.
Okay. Yeah, thank you, Ivy. Thank you everyone for attending the webinar this morning. So today I'll be sharing more on healthy eating for our stomach. So this is the overview of my talk. First, we will look at the function of the stomach, the incidence of stomach cancer worldwide and in Singapore, the dietary components that potentially increase or decrease the risk of stomach cancer, and a summary. So now let's us quickly look at the function of the stomach. Our stomach is actually a J-shaped bag that receives food that we eat. So it's like a reservoir, as what Prof. So has mentioned. And the food are then mixed with gastric juices and broken down into smaller molecules during the digestion process. And stomach cancer is the 5th most common cancer worldwide and one of the top 10 cancers in Singapore. And in Singapore, it's the 7th most common cancer for male and the 9th most common cancer for female. And these are the top 5 countries with the highest rate of stomach cancer in 2018. And all these countries are actually located in the East Asia. South Korea topped the list, followed by Mongolia, Japan, China, and Bhutan. And so what do the diets of the Japanese, Koreans, Chinese, and the Mongolians have in common? So here I have some newspaper reports and study reports commenting on their dietary habit and the risk of developing stomach cancer. And all these reports actually pinpoint to the same culprit, which is high salt. And in this Korean study, the researchers found that a high salt intake may increase the risk of stomach cancer by 10%. And this was a study done in more than 2 million of people. We may be less familiar with the food in the Mongolia. And here we have a Mongolian local study published in 2018. They found that actually excessive amount of salt was dramatically higher in the northern and western part of the Mongolia, where the precancerous diseases such as the erosive esophagitis and severe atrophy were highly prevalent. And in a study in the Japanese, the researchers found that the risk of stomach cancer for men with the highest salt intake was twice the rate for those who ate the least salt. And they do comment that salting, pickling, and smoking are traditionally popular ways of preparing food in Japan. The pickled vegetables and noodles are rich in sodium and low in vitamin C. And study in Chinese population concluded that salted meat, pickled, and preserved vegetables are positively associated with gastric cancer. So now let's look at the dietary and lifestyle factors that affect one the risk of one developing stomach cancer. As we can see from the previous reports on the previous slides, excessive intake of salt and processed food is one of the major risk factors of developing stomach cancer. And we have inadequate intake of fruits and vegetables and being overweight or obese. And a high salt concentration in the stomach actually causes inflammation and damage that lead to diffuse erosions and degenerations. And high salt food, such as those that present in the processed meat and salted fish, contains nitrites and chemical carcinogens such as nitrosamines. Sodium nitrite is widely used in curing meat because it can prevent bacterial growth, and the digestion of nitrites in the stomach will also produce more nitrosamines. And on the other hand, the nitrosamines are also found in tobacco products, certain drugs, and also industrial materials. So studies have found that the presence of nitrosamines actually can increase the risk of one getting stomach cancer. And here I have a list of ingredients for luncheon meat, and we can see actually sodium nitrite is one of the ingredients used as the preservative. And the same goes to corned beef. When we look at the ingredient, actually sodium nitrite is present. So here we have more examples of food which is high in sodium. For example, soy sauce, chicken cubes, salted egg, salted meat, and even pickled vegetables. So the infection of H. pylori is an established risk factor, but may not be a sufficient cause for the development of the disease. So the researchers believe that actually the mucosa damage caused by the salt or those high salt food actually may increase the possibility of persistent H. pylori infection and hence promote the development of the disease. And some evidences show that eating large amount of pickled vegetables and salted vegetables may increase the risk of getting stomach cancer as well because of the N-nitrosol compounds produced by the mold or fungi that's sometimes present in this kind of food. So how much salt do we actually need? The recommended intake is actually not more than 5 grams or not more than 1 teaspoon per day, which contains 2,300 milligrams of sodium. However, it's reported that the average daily intake of salt of an adult in Singapore is 9 grams, which is almost double the recommended limit. So this table shows the common food that we have and the sodium content in this food. And we can see a teaspoon of salt contains 2,300 milligrams of sodium. And for example, a slice of luncheon meat contains 390 milligrams of sodium, which appears to be still quite way below this 2,300 milligram limit. But please bear in mind that this may not be the only food that we take on a single day. And by the end of the day, we can easily exceed the amount. So knowing the danger of the salt and sodium, now let's look at some tips on helping us to reduce our daily sodium intake. So let's say when we are shopping for food, always buy fresh food, fresh ingredients, or fresh vegetables as compared to the canned or the salted ones. This is because fresh vegetables are naturally low in sodium. And try to limit canned products, including those like luncheon meat or even like chicken curry, sausages, ham, hot dog, because these kind of food are high in sodium. Do read the food labels to help you in making selection of those food which is lower in sodium. You may be surprised to learn that 100 grams of chocolate chips breakfast cereals contain almost up to 490 milligrams of sodium. And when you are cooking at home, do taste the food before we add in salt or sauces, and use more natural herbs and spices such as coriander leaves, garlic, onion, turmeric powder to give taste to our food. And we can also replace butter and margarine with pure vegetables oil such as peanut oil or canola oil or sesame oil. And when we are eating out, for example, when we are ordering economic rice, ask for less gravy or sauce. This will also help you to cut down on the fat intake as well. And avoid finishing soup when we are taking those soup-based dishes, and limit preserved food items such as like anchovies, sausages, pickled vegetables, Sichuan vegetables, and so on. Reading food labels is very important. We can use this so-called instruction with no added salt or low sodium products. Choose foods that have less than 120 milligram of sodium per 100 gram. And the food which with healthier choice symbol may help you in making selection too. So we have an acronym here, SALT, stop adding too much salt and sauces, avoid salted and highly processed food, leave out gravy and soup, and try to have alternative flavorings and use fresh ingredients instead. And another one will be being overweight, BMI 25 to 29.9, or obese, BMI 30 or above, may increase the risk of one getting gastric cardiac cancer. So cardia is the region of the stomach near to our esophagus. And this is because an overweight or obese person have a higher risk of developing gastroesophageal reflux disease or GERD. And the persistent or continuous acid reflux may damage the lining of the cells near the cardia region. So if you are overweight or obese, it's good to start to lose weight from now. And a diet rich in fruits, vegetables, and fish are found to decrease the risk of stomach cancer by 60% in female and by 54% in male. And fruits and vegetables are rich sources of phytochemicals that can act as antioxidants, such as these flavonoids, carotenoids, vitamin A, C, and E. Antioxidants are able to help us to protect our healthy cells from damage by the free radicals, and hence having a protective role against the development of cancer. This is the nutrition rainbow. Different color pigments contain different antioxidants. For example, red pigments contain lycopenes and are abundant in tomatoes, watermelon, and strawberries. And purple pigment found in grapes, plums, and berries are rich in flavonoids and anthocyanins. So it's recommended to have 2 servings of fruits and 2 servings of vegetables every day. A serving of fruit is equivalent to a small apple, a medium size of banana, a veg of watermelon, or a small orange, whereas a serving of vegetables is equivalent to 100 grams or about 3/4 cup cooked of leafy or non-leafy vegetables. And studies have found that taking fruits are able to help us to reduce stomach cancer by 15%, and in particular, citrus fruits by 28%. And the protective effect of the citrus fruits increases progressively until about 3 servings per week and level off thereafter. So the example of citrus fruits are grapefruit, lemon, oranges, and even the pomelo. So in summary, please remember that there's no one food that may provide all the nutrients that we eat, that we need. And therefore, it's important for us to choose different food from the 4 food groups that we have, which is the carbohydrate, protein, fruits, and vegetables. And remember that a healthy and balanced diet with less salt will not only help us to reduce the risk of stomach cancer, but also keeping us healthy and fit. Yeah, thank you.
Thank you, Ms. Wong. Thank you very much. And next up, we have the panel discussion. We are now open to the Q&A to the floor. And can we show the screen? Yes, we invited the doctors back on screen. Thank you very much for both Professor So and Ms. Wong. And let me now take a look at the questions that has come up. So the first question we have here is that if I had any other cancer such as lymphoma, but is treated at the cancer center already, what are the chances to get gastric cancer as well?
Yeah, it depends on what type of cancers, Dr. So here. And yeah, for example, lymphoma, there's no direct link between lymphoma and the gastric cancer. But certain cancer, for example, like colon cancer, and that have some relationship, because there's some cancer syndrome. They have a group of cancer coming together to affect one person, including stomach cancer and colon cancer. So it depends on the type of a cancer. And for lymphoma, there's no link between lymphoma and gastric cancer.
Thank you. Thank you, Professor So. And the most common thing for Singaporean, gastric reflux. And is gastric reflux, or rather a direct cause of gastric cancer or with higher chance of getting gastric cancer?
Yes, I think severe gastric reflux, yes, is a risk factor for esophageal and upper stomach cancer. And therefore, if the patient have a severe reflux, then the reflux are causing damage to the lower part of the esophagus, and that will increase the risk of gastric or esophageal cancer. Therefore, mild reflux is not really a risk factor for gastric cancer.
How long should a person receive treatment for gastric reflux? Would extended period of gastric reflux put them at the risk too?
Yeah, the treatment itself won't. I think the main thing is are we sure this is due to acid reflux or actually due to a more serious disease? That if the person have prolonged treatment more than a month or two, then I usually will advise the patient have an endoscopy first, just to rule out that there's actually due to a tumor before we just treat it as simply as a reflux.
So pain. Every pain could lead to stomach cancer, or how do we differentiate gastric cancer from other normal stomach pain? What tests?
This is a difficult question because I think even many doctors or many patients misdiagnose this problem. And as mentioned, that there's many causes of a gastric pain, and gastric cancer is just one of the many causes. So usually will depends on the patient's profile, the age, the family history, and from that, if the person is more than 40 years old, started from a middle age and above, and if the symptoms is keep coming back, then usually we'll have to advise the patient go for endoscopy just to be sure this is not a gastric cancer before advise them to give medications.
I see. What is a subepithelial lesion?
Yeah.
How is it related to gastric cancer?
Well, this is the most of the cancer is appear on the layer called epithelium, which is the innermost lining of the organ. Therefore, we call it a mucosa in the stomach. And if the most of the cancer started from this layer, from the mucosa or from the epithelium. Therefore, for tumor arising below it, therefore usually not the standard stomach cancer. They are due to the other type of tumor, which is less common compared to the cancer.
And the other question is frequent bloating, having a lot of gas. Is that a sign that they should worry that this could be stomach cancer too?
Usually are due to acid reflux, but this also can be due to a tumor. Therefore, again, we will treat like people with dyspepsia. If the person is the symptom persists more than 4 weeks or month, then we will usually advise to have an endoscopy.
So I hear endoscopy again and again. And during your talk, you talk about endoscopy, and endoscopy is the way for us to find out what's happening inside the stomach. Is there any other kind of test that we can do other than endoscopy?
The main thing is because the symptom of a stomach cancer are very non-specific, they're easily missed. That's why we need to use endoscopy to detect, because the symptoms are not reliable. And currently, endoscopy is still the gold standard. As we know that we are developing a blood test using some genetic marker in the blood, and this is still on the research stage. So at the moment, anything in doubt, the best test is still an endoscopy, which is actually a short, quick procedures in the outpatient setting.
I specifically rule out or bring out this question is because I know a lot of people are trying to avoid getting an endoscopy. Mm-hmm. And they were afraid of getting an endoscopy, but an endoscopy is actually very important to find out more, because we can't see what's happening inside. As you have seen the video from Professor So's presentation, it's actually very, very how should I put it? You actually see inside the stomach lining. So that's very important.
Yeah, and the procedure is, sorry, just add the procedure, we make it as comfortable as possible. So it used to be actually performed, the procedure can be performed when the patient's awake, but to make it the patient more comfortable, more pleasant experience, now many of us will perform the endoscopy with some medications so that the patient is calm and they can sleep during the few minutes of the endoscopy.
Okay, I have two questions here for Ms. Wong. One is the most in thing, intermittent fasting as a form of irregular meal times, and also the keto diet that has gained new ground, new light. Are these all a danger to the stomach? Ms. Wong?
So for intermittent fasting, let's say, for example, a person is having irregular meals and then they at the same time is having like gastric reflux, gastric discomfort. I mean, we would discourage patients from having intermittent fasting because they could fast from 8 hours to more than 10 hours per day. And excessive production of gastric juices may actually irritate or exacerbate the condition of the pain or discomfort. And for keto diet, generally, there's a lot of promising evidence, but mostly it's done in animal studies. In terms of human-wise, there are some so-called promising or positive outcome done in those people with brain tumor or glioblastoma, but not really in other form of cancer. So I would say that for keto diet, because basically it's high in protein and also fat as well, and low in carbohydrate. So some people, for example, with kidney impairment may not be suitable, and also with some heart condition. So they may need to seek their advice from their dietitian and also doctor.
Yes, it's always collective. When you are not well, there is a team of doctors and dietitians working with you to make sure you get better. And sometimes we find patients pick and choose. They choose to see the doctor, but not the dietitian, thinking that this is always going to ask me, don't eat this, don't eat that. There's nothing much to eat anymore. And so they choose to see the doctor, but not the dietitian. But they come as a group. They're together and they know all your symptoms and they're trying to treat you and make you feel better. The next question is, drinking lemon water, vinegar has been touted as having health benefits. For some that has said they are acidic, whereas some specialists said that once ingested, lemons turns alkaline too. So, what does it do to our lining, our stomach lining, Ms. Wong?
So generally, if let's say it's more to like a symptomatic measures, if a person is having like gastritis or stomach discomfort, then they may be discouraged from taking those like acidic drinks or food. But generally, even though if fruit or vegetables are classified as alkaline or acidic, but they wouldn't be changing the pH of our blood or in our body, and thus doesn't having any really specific or significant effect. Okay, but it's more to, let's say when a person is not having or is like having abdominal discomfort, that they may need to avoid sour food or acidic food in general. So, I do see that there's like some comment asking about taking lemon juice or diluting the salt and so on. So it really depends on the symptomatic or the symptoms that patient is having. And but as I shared in my slides earlier, if a person does not have these symptoms, taking citrus fruits in fact may have a protective effect against the development of stomach cancer.
So in one of your slides, you shows the countries like Korea, Mongolia, China, and then and Singapore comes as the top 5. One of the question I have is here whether ethnicity, which means in Singapore itself, is there any ethnic group that has a higher chance of higher risk of stomach cancer, and why so?
Actually for Chinese, because of the consumption of like salted fish, pickled vegetables is quite common in their diet. And nowadays, because of the luncheon meat and canned food is another major factor as well. So and we may need to decrease. Okay, it's not only because of the salt, but also because of the preservatives and nitrites content in this present in this kind of food. Yeah, and as I mentioned earlier, because in those pickled vegetables, even the mold or the fungi in the vegetables itself may produce the N-nitroso compounds, which is actually also a chemical carcinogen that may promote the development of the disease.
Yeah, with the upcoming of mala guo, everybody having their mala where they have their luncheon meat. It looks and feels so good, tastes so good, but then the subconscious consumption has gone higher too. We have a real questions as in the medical question here. Done gastroscopy and colonoscopy in May 2019. The symptoms were polypoid gastric mucosa, chronic gastritis, mucosa erosion with focal and reactive changes, reflux at night, and gastric aches sometimes, but no evidence of HP bacteria, intestinal metaplasia, and dysplasia or invasive carcinoma. Do the rescope need to be done a year later, or when, and how to deal with it?
I don't. That looks like the report is a good report. Then the person probably experienced what we call a gastritis, and gastritis are usually are due to either the bacteria Helicobacter or due to some of the medications such as some painkillers, and this condition is benign. Therefore, we don't recommend that every yearly to do endoscopy. They probably just to monitor the symptoms. If we require, we can do an endoscopy every 5 to 10 years.
I see. And would metaplasia develop into cancer? And is the GIST, gastrointestinal stroma tumor, a precursor to cancer? We recurrent acid reflux accelerate the metaplasia into cancer?
Yeah, okay, first question, that intestinal metaplasia is a very common condition due to aging or due to the bacteria infections. And this is one of the many risk factors of a gastric cancer. But in general, if it's the intestinal metaplasia is mild, the risk of a cancer is very low. There's no need to be too worried about it. And second is GIST or GIST, which is what we call a gastrointestinal stromal tumor. This is another type of a tumor commonly occur in any part of the digestive system. And this is different from cancer because this is the tumor is what we call a subepithelial, and they are arising from different structure of the stomach. And this tumor usually are responding to many of the drug agents and have a better chance of cure. And thirdly is the acid reflux. As mentioned, the acid reflux can increase risk of cancer, especially if the reflux are very severe and is for long duration, then you will increase some of the risk of the gastric cancer or esophageal cancer.
Long-term consumption of aspirin or Hep B carriers, are they also higher risk gastric cancer?
Yeah, that consumption of the aspirin is a risk factor for ulcer formation in the stomach. You hurt our stomach, but it's not a risk factor for gastric cancer, but it can cause a gastric ulcer. And H. pylori or the Helicobacter pylori is one of the main agent causing gastric cancer. And this bacteria actually is very common in our general populations. But you increase the risk of gastric cancer. So if we know the person have this bacteria in the stomach, usually we're advised to have antibiotic treatment.
Yes, hepatitis B carrier, are they also at greater risk for gastric cancer?
Hepatitis B is an important risk factor for liver cancer, but not the stomach cancer.
I see. And you mentioned just now about the Hep B, H. pylori.
Helicobacter.
Yes, Helicobacter pylori. And that is something that is transmitted through, how does it get transmitted?
Well, still not really sure, although this bacteria is very commonly in our stomach. Most people believe that it's through sharing of food utensil during the childhood, and they pass the germs. But the exact transmission mode is still not very sure.
So either way, we have grandma feeding the children and they blow at the food, or you have a helper at home and this is not tested. This actually leads to a danger to children too, where they were blowing at the food and the germs could actually come from the saliva and the breath. And sharing of food, that's why you have common utensils to avoid such situations. Let me see if there's any other questions that comes through. Oh, yes. One more here is, someone has previously undergone 2 keyhole surgeries for unrelated illnesses. Can this person undergo more keyhole surgeries? What are the limits?
The keyhole surgery is usually have a less side effect and less risk of adhesion or less risk of scarring within the abdominal cavity. Therefore, is that the persons, if they require to undergo further surgery, you make the further surgery easier to perform compared to a standard surgery. Therefore, I think there's no limit of the person to go for another surgery or not, especially if the previous surgery is a keyhole surgery.
I see. And very importantly is that whenever they see the doctor, and it's often asked to go back for follow-ups. And, for Professor So, could you give us a little bit of explanation? Is that if after a person who's getting a yearly scope, why so? And what are the things they should actually look out for?
And actually, we seldom ask the patient to go for yearly endoscope unless the person have very, very, very high risk of relapse cancer, because we know endoscopy is inconvenient. Therefore, that therefore we depend on the patient's condition and the disease, and there's a standard guideline for us to guide the doctor to advise how frequent and what tests the person need to come. For example, if the patient have a history of a stomach cancer, then usually we will always want to monitor the patient for first 5 years for 2 purposes. One purpose is to whether the tumor relapse, because usually they relapse within the first 5 years after the treatment. Second is to monitor any side effect from the treatment, for example, side effect from the surgery, which commonly affecting the nutrition. In those situations, we work closely together with the dietitians. We advise the patient to also follow up with the dietitian as well after the treatment for the stomach cancer.
In your years of treating stomach cancer, do all the stomach cancer patients have experienced pain?
Not really. And especially in the certain type of gastric cancers are very quiet, and hardly any symptoms. In those cases, the symptoms may be other symptoms such as bleeding or blockage. But on the whole, the most common symptom is gastric pain.
So in general, we should also look at what we got rid of in the toilet bowl. Looking at the color of the feces is important, isn't it?
Yeah, this is especially, this is also an important sign of colon cancer, which is the #1 cancer in Singapore. And therefore, we actually look at the toilet bowl before you flush is a very, very good self-examination skill, and to look at your health. Therefore, this is a very good trick, Ivy. I think that I also recommend to our patients.
Okay. So one thing very importantly is that the doctor wouldn't want to see you if there's no cause for concern, but sometimes they need a long-term follow-up to monitor the situation. If you are in doubt or have any questions, you should always find the time to ask the doctor, why did you keep asking me to come back? And what are you trying to find out? Because for them, only when seeing you doing the examination, then they could understand what are the changes to your body. And the next thing is that I think having a healthy diet, whatever diet you try, you should feel good. if after the dieting or choosing that diet, you don't feel good, then maybe that's not for you, because our DNA is different and everyone is different. What works for your friends and your family may not work for you. Anything to add on from Ms. Wong?
Sorry, can you repeat the question? Because I was looking at the question from the participants.
So the question is this. So when they are following a certain diet trend and they don't feel well, should they continue or give it time? How long should they give it?
I would say that if they are not, I mean, the body is not suitable or they are having any side effects, I would say that perhaps maybe in a week or two, they should discontinue and go back to a normal diet, okay? And also seek advice from professionals, okay, to make sure that whatever they are taking does not do more harm to the body based on their medical conditions. Yeah.
Okay. One question we have here is that, Professor So, is there any other way, or is there a cancer marker testing to help detect stomach cancer? I know you touched on it just now a little bit about we're talking about endoscopy.
Yeah. Well, we are active. This is one of the area we are actively research on it. Yeah. Very soon we're going to release our results of blood tests, which is may help to detect cancer. And we know that it's not feasible, not possible to have endoscopy for everyone. But in certain countries such as Japan and Korea, they have this national program to have endoscopy for everyone older than 50 years old, but may not be feasible for Singapore. That's why one of the key research we are doing is this blood test. And but before we prove it, I think there's still endoscopy is still the gold standard and so-called gold standard for our stomach.
Okay. And last question, what is the diet for intestinal metaplasia? Ms. Wong?
Intestinal metaplasia. So generally, if basically it's still to have a regular high fiber or adequate fiber intake, to have like 2 servings of fruits, 2 servings of vegetables every day, and do make sure that we do limit red meat. Okay, if there is any, not more than 2 servings a week. A serving is something like a 100 gram or 120 gram or about a palm size. So make sure that there's adequate hydration as well. Okay, to make sure that's like to promote the intestinal health. Yeah.
Thank you. With this, we have come to the end of today's webinar. We once again thank you, the doctors and Ms. Wong and the organizing institutions and all the volunteers and Singapore Cancer Society for organizing this webinar, and for the speakers for sharing the expertise on gastric cancer with us. We thank you all, and remember everyone, wear mask up if you're outside, and sanitize and wash your hands. Stay safe, stay healthy, and stay positive. Out there, someone needs you. And with this, we thank all the doctors and Ms. Wong, and we will have it as a wrap. Thank you, everyone. Have a great Saturday. Thank you. Thank you.
Thank you, everyone. Thank you, Ivy.